Sunscreens. What are your patients really worried about? Summer's here and parents are worried about sun protection. Or are they? Interestingly, there's a lot more talk in the media about the danger of not getting enough vitamin D as a result of sunscreen use instead of the importance of protecting against skin cancer. Your patients may also be talking about sunscreens actually causing cancer and how some ingredients are endocrine disruptors. A recent question brought up by a mom to me was that the European Commission has banned certain sunscreens that are allowed to be used here by the FDA. With all of these myths floating around, let's chat about common myths and the true facts. Myth number 1, you will become vitamin D deficient if you use sunscreen. Although the American Academy of Dermatology contends that there's no amount of UV exposure that's safe enough to prevent skin cancer, we do know that the sun can certainly contribute to appropriate vitamin D levels. A prospective 20-year study of women conducted in Sweden and just published this year underscores the important potential health benefits of sun exposure, concluding that avoiding sun completely had negative health effects comparable to smoking. Some experts suggest that only 5 to 30 minutes of sun exposure, though, twice a week between 10 a.m. to 3 p.m. would be enough for vitamin D synthesis. An evidence review that looked at this question concluded that even though sunscreens can reduce the production of vitamin D under very controlled conditions, their regular use will not usually cause vitamin D deficiency. Also, most people don't even apply enough sunscreen and certainly don't reapply it frequently. In fact, in a study released last year in the Journal of the American Academy of Dermatology, only 15% of men and 30% of women use sunscreen as recommended. Almost half, 42% of men, never use sunscreen at all. So, available data suggests sunscreen use does not substantially affect vitamin D absorption. Myth number 2. A parent asked me if she should be worried about the connection with sunscreens and early puberty. Another question that I was recently asked was, have sunscreens been linked to cancer? In other words, are sunscreens actually causing disease? Oxybenzone, a chemical-based ingredient found in sunscreen, has been specifically called out by several consumer media sites as being an endocrine disruptor. A study done in rats given large amounts of oral oxybenzone raised concern about estrogenic effects of this agent. But several studies of this product used topically as a sunscreen and done in humans concluded that this was not the case even with large topical doses. Myth number 3. Have the Europeans banned the chemicals we use in our sunscreen? Bottom line, no. There are no ingredients approved in the US and banned in Europe. The Scientific Committee on Consumer Products of the European Union published an opinion paper in 2008 based on a review of current evidence of safety of oxybenzone and concluded that it was safe. In contrast, there are 8 sunscreen ingredients approved in Europe that are not approved by the FDA. For all of these ingredients, the FDA has determined that they need more data to decide if these ingredients are, in fact, safe for use in over-the-counter sunscreen products. So what should your patients know about sunscreens? Sunscreens are effective at preventing skin cancer and sun-related damage, and they are necessary. The American Academy of Dermatology provides online advice for consumers on how to purchase and use sunscreen. And the Skin Cancer Foundation provides numerous downloadable patient education tools on all things sun-related, including sunscreen, clothing, and eye protection. We actually have links to these resources in the text below. Remind patients and families that other measures in addition to sunscreen are just as important. Covering yourself, not playing outside at certain times of the day, and reapplying every 2 hours, especially if swimming. And wear those sunglasses too. Now that you know the facts, hopefully you're armed and dangerous to educate the troops on what they really should do. Use sunscreen and protect themselves and their families.